Our second drug is Alpelisib with the brand name Piqray. Piqray or Alpelisib falls under the category of kinase inhibitors. Piqray tablets is indicated in combination with fulvestrant for the treatment of postmenopausal women. Fulvestrant is an estrogen receptor degradator. So, in the next slides, we will discuss Piqray, what is the mechanism of action of Piqray, but for now, we should know that fulvestrant is an estrogen receptor degradator, meaning to say it will break down or it will destroy all the estrogen receptors in the body. They are used for the treatment of postmenopausal women and men with hormone receptor positive, human epidermal growth factor receptor type 2 negative, PIK3CA mutated genes, advanced or metastatic breast cancer, as detected by an FDA-approved test following progression on or before or on after an endocrine-based regimen. Now let's talk about the mechanism of action of our drug. Alpelisib is an inhibitor of phosphatidylinositol 3 kinase with inhibitory activity predominantly against phosphatidylinositol 3 kinase alpha. Gain of function mutations in the gene encoding the catalytic alpha subunit of phosphatidylinositol 3 kinase or the PIK3CA led to activation of phosphatidyl 3 kinase alpha and AKT signaling. So what does PI3K alpha and AKT do is they will signal cells in the body to generate tumor cells. Okay, specifically in the breast cells in the body. So we need to inhibit this specific isoform of the phosphatidylinositol 3 kinase so that PI3KA and AKT will not be formed, no tumors will form, and we can save the breast of the patient. In breast cancer cell lines, alpelisib inhibited the phosphorylation of phosphatidylinositol 3 kinase downstream targets, including the AKT, and it showed activity in cell lines harboring a PIK3CA mutation. In vivo, alpelisib inhibited the PI3K and the AKT signaling pathway that lead to the reduction of tumor growth in xenograft models, including models of breast cancer. The PI3K inhibition by alpelisib treatment has been shown to induce an increase in estrogen receptor transcription in breast cancer cells. The combination of alpelisib and fulvestrant demonstrated increased anti-tumor activity compared to either treatment alone in xenograft models derived from ER-positive PIK3CA mutated breast cancer cell lines. This is what I am talking about in the previous slide. When we use the alpelisib, the side effect of the drug is it will induce the production of estrogen receptors in the body. We all know that in breast cancer, we don't want too much estrogen in the body. So now, to correct this disadvantage or drawback of the drug, we need to co-administer alpelisib with fulvestrant. Our fulvestrant, just like what I have said, is an estrogen degradator, estrogen receptor degradator, meaning to say it will destroy all the estrogen receptors in the body, so the estrogen cannot take an effect anymore. This leads to increased anti-tumor activity of the combination of the drug. Alpelisib is available in 3 doses. We have 50 milligrams, 150 milligrams, and 200 milligram tablets. The recommended daily dose is 300 milligrams, so you need to take 150 milligram tablets. You need to take the tablets orally once daily with food. Let's talk about the unique characteristic of our drug. So Piqray is the first of drug ever made that inhibits phosphatidylinositol 3 kinase alpha. We have drugs that inhibits phosphatidylinositol 3 kinase, but they are not specific, unlike our Piqray. Piqray, unlike other phosphatidylinositol 3 kinase inhibitors, this drug inhibits a specific form of that enzyme, the alpha form. What makes this good, or what is the advantage of this? This will give us better option to the therapy of patient with breast cancer due to mutations of genes encoding phosphatidylinositol 3 kinase alpha. In conclusion, we can say that Piqray showed distinct character of effectivity but with some moderate to severe side effects. Because of the benefits that weighs the risk, following considerations must be observed prior to the therapy. Blood tests before and during your treatment with Piqray is a must. Make sure that you regularly test your blood sugar before you start treatment, during the treatment, and after you stop treatment with Piqray. Piqray is not to be used in children and adolescents under 18 years of age. Piqray must not be used by women who are or may be pregnant or breastfeeding. If you want to know more about Piqray, you can visit these three websites showed in the slides, and also for further information and results of clinical trials of this drug, you can go to Novartis Pharmaceuticals Corporation website, and also the study of Markham 2019 titled Alpelisib First Global Approval, Springer Nature, Switzerland.